The impact of cannabis on our littlest ones, unraveling the mystery, a growing concern, cannabis and pregnancy. In today's world, the use of cannabis has undergone a dramatic shift, driven by changing societal attitudes and a growing belief in its therapeutic benefits. However, this trend has a dark side, especially when it comes to pregnant women and their unborn children. The rise in cannabis consumption during pregnancy, coupled with the increasing potency of cannabis products, is a worrying development that demands our attention. The science behind THC's impact. THC, the psychoactive compound in cannabis, easily crosses the placental barrier, entering the fetal environment and potentially disrupting the delicate endocannabinoid system, which is crucial for brain development. Unlike most substances, THC can accumulate in fetal tissues, potentially leading to long-term neurodevelopmental issues. And it doesn't stop there. THC also passes into breast milk, exposing breastfed infants to its effects postnatally. This raises serious concerns about the sustained impact on critical growth periods. Epidemiological evidence, a cause for alarm. Studies have linked prenatal cannabis use to a range of adverse perinatal outcomes, including lower birth weights, increased risk of preterm labor, and higher admissions to neonatal intensive care units. These indicators suggest that babies exposed to cannabis in the womb face immediate health challenges, and they also suffer from subtle developmental issues later in life. Longitudinal research further reveals alterations in brain structure and function among these children, impacting memory, attention, and executive function, which are vital for academic success and social integration. The challenge of establishing causality. The ethical constraints surrounding controlled trials with pregnant women limit our ability to definitively prove causation. Most of our current knowledge is based on observational studies and meta-analyses, which, while robust, cannot completely eliminate confounding factors. We urgently need well-designed longitudinal studies to better understand the complex interplay of cannabis exposure, genetics, socioeconomic factors, and other substance use so we can accurately define causality and risk. Understanding THC's disruptive potential. The endocannabinoid system, with its CB1 and CB2 receptors and endogenous cannabinoids, plays a critical role in neurogenesis, neuronal migration, and synaptic pruning during fetal development. Exogenous THC's affinity for CB1 receptors in the fetal brain disrupts this tightly regulated process, leading to abnormal wiring and neurochemical imbalances. These molecular disruptions may underlie the structural and functional brain abnormalities observed in exposed infants. The modern cannabis landscape, a cause for greater concern. Modern cannabis cultivation and product formulation, with strains engineered for maximum THC potency, expose consumers, including pregnant women, to vastly different doses than in past decades. This, coupled with the entourage effect of other cannabinoids and compounds in cannabis, complicates predictions of fetal impact and amplifies the risk profile. Beyond birth, behavioral, and psychiatric concerns, there is growing evidence suggesting that prenatal cannabis exposure may lead to behavioral disturbances and psychiatric vulnerabilities in children. Disorders like ADHD, anxiety, and depressive symptoms have been reported at higher rates in these populations. While causality is yet to be conclusively proven, these associations demand increased clinical vigilance and public health intervention. Challenges for healthcare providers. The prevalence of cannabis use during pregnancy presents significant challenges for healthcare professionals. Screening protocols, counseling strategies, and harm reduction approaches are still evolving, and consistent, evidence-based guidelines are urgently needed. Healthcare providers must strike a balance between respecting patient autonomy and clearly communicating potential risks. Countering misconceptions. The need for effective public health messaging. The widespread narrative of cannabis as a benign or beneficial substance, often cited as a remedy for morning sickness or anxiety during pregnancy, lacks robust evidence and ignores associated harms. Public education campaigns must use the latest scientific findings to inform expectant mothers and caregivers, promoting informed decision-making. Policy implications. Monitoring and intervention. With the legalization and increased accessibility of cannabis products, there is a need for concurrent reinforcement of frameworks to monitor usage trends in vulnerable groups, such as pregnant women. Surveillance systems and registries could provide real-time data to inform targeted interventions and resource allocation. Collaboration across healthcare, social services, and detention and law enforcement sectors is essential to create a comprehensive strategy. The promise of technological advances. Advances in neonatal neuroimaging and biomarker identification offer hope for early detection of cannabis-related neurodevelopmental disruptions. Implementing these diagnostic tools in clinical practice could lead to early intervention and potentially mitigate adverse outcomes through tailored therapies and educational support. The need for further research. While observational evidence is accumulating, there is an imperative to expand preclinical research using animal models and in vitro systems. These studies can shed light on mechanistic pathways and dose-response relationships, guiding safer therapeutic development and policy formulation. The broader impact, societal and economic consequences. The implications of THC exposure extend beyond individual health, potentially impacting education, workforce participation, and healthcare burden. A comprehensive meta-analysis of these broader consequences is crucial to fully understand the magnitude of prenatal cannabis exposure. As we navigate these complex challenges, one thing is clear. Prenatal exposure to potent cannabis poses significant risks to neonatal and neurodevelopmental health. Effective strategies to curb usage during pregnancy must be grounded in rigorous research, multidisciplinary collaboration, and transparent communication to protect the health and well-being of our next generation.